I'm Dr. Chandra Puli, Senior Gastroenterologist practicing at KIMS Hospital, Hyderabad. Today, I'm going to talk about non-alcoholic fatty liver disease, also called NAFLD. The topics I would like to cover in this are what causes the fatty liver disease, which is very common when you have a scan for various other reasons. How can you prevent the fatty liver disease developing? Are there any risks to cause the fatty liver disease? What are the treatment options available and what precautions can you take? How is this fatty liver disease diagnosed in the first place? Majority of the times, the referrals I get from the fatty liver disease are they go for a scan for unrelated cause. They have tummy pain or whatever it is. And when the radiologist does the scan, he normally reports that they found some extra fat in the liver cells. And they report them fatty liver disease grade 1, grade 2, grade 3. That's how most people find they have problem. Another group of patients that come to me, they had a blood test and one of those liver enzymes is elevated, and the referring consultant says to have an opinion from gastroenterologist. These are the common two presentations that tend to come to a specialist. But patients do say they have fatty liver is that they have non-specific pain in the stomach, especially on the right side. But generally, it doesn't cause that severe pain. But only in extreme cases when the fat is so much, stretching the capsule can give them pain. But I would not suggest that's only cause for their pain, but it tends to overlap. That's another presentation. Generally people feeling tired, they have the blood test, and then we could pick those things up as well. And these are the most common presentations. This is very, very common question that I've been asked by many patients. Am I at risk of having a fatty liver disease? So first thing we need to look at is that which group of patients are developing the fat in the liver. It's very obvious if you got extra fat elsewhere, you're likely to have extra fat in the liver as well. So obese patients, people who are diabetic, because how the insulin works on these patients makes the fat accumulation within the liver like this, as you can see. I don't want to scare you, so extra accumulation of fat in the liver. If you're diabetic, there are certain medications which can also cause fat accumulation within the liver. These are the most common presentations of these people who are having fatty liver disease. How is the fatty liver diagnosed? As I explained to you, that majority of the patients, they have scan and the radiologist confirms they got excess fat. Or they have blood tests which tells their liver enzymes are elevated. And we tend to do a different type of scan to actually see to what stage they are in this fatty liver disease. So if you're in the early stages, lifestyle and diet modifications are good enough for them. So that's called fibroscan, that's called stiffness. So if you just see, is it soft or is it hard? So that's called fibroscan. So we have a special measures to measure them. And this is a very simple test. We put a little probe, send some sound waves, and the stiffness will come back and just tell us, is the liver rock hard or soft? The gold standard to diagnose this is actually take a tissue from the liver, where we put a needle in and take a small, very small sample. You don't need to worry about it, because just like we have an injection, it's a similar process. We just take a sample and we look under the microscope. The reason why we do that is because within the fatty liver disease, there are a group of patients who can develop a condition called cirrhosis. Only 10%, if you take 100 people, only 10 of them will develop that. To actually know this process, what we do is there are risk stratification, which type of patients go into this type of stage where the liver becomes rock hard, like fibrosis. or actually if the liver enzymes is consistently elevated, or they have problem of alcohol on the top of this fatty liver disease, or they have a special condition called metabolic syndrome. What it means is that they have got diabetes, hypertension, high cholesterol, and a visceral fat, which they have like a excess fat in the around the belly area. These are and being an Asian is also a risk factor for these patients. Okay, and in these group of patients, they continues to have not just fat accumulation within the cell breaks and causes inflammation. What it means is that it causes a healing process when the cell breaks, and the healing process stops by scarring, just like you cut your hand or something like that, and then the healing happens by scar formation rather than the original tissue, which is what brings this problem to, say, cirrhosis. So, and if you take 100 people with fatty liver, very small group can develop into this phase, and this is where we address this problem, or we monitor them very often. It depends on which stage of fatty liver disease you are in. Are you in the advanced stage like this, or in the early part of the fatty liver disease, is what makes the treatment options very, very important. If you're in the early part of the phase, which is just the fat accumulation in the cells, we give lifestyle modification. What does it mean? Giving you regular exercises, so where you burn your calories, which means you're burning your fat, which means you're burning the fat from the liver. That means you have to lose weight. How much should I lose weight is most important thing. You make a target, say I want to lose half kilo every week, which is realistic, or you can lose 1 kilo every week, which means you're losing 4 kilos in a month. It's not too much to ask for. Not only just doing an exercise. What does this doing an exercise means? Just not going along a slow walk with your friends. You actually have to sweat. That's when you develop a new metabolism called an anaerobic metabolism, which means you're breaking down your fatty acids. So if you're just walking around with your dog and friends, it doesn't help you. You have to run where you need to sweat, and you have to breathe fast. So those are called exercises. A lot of the time I've been told I walk on my terrace or I walk on my balcony. That doesn't really work. What works is basically to make you hard sweating exercises for minimum 20 minutes a day is good enough for you. Okay, so lifestyle modification is exercise. Number 2 is about the diet. The diet involves avoiding carbohydrates, avoiding fatty foods are the most important 2 things, and increase your protein is another one. And also, people do ask me, are there any medications? So there are trials which showed vitamin E does help, or metformin does help, or controlling the underlying factors. For example, metabolic syndrome is there, you just address those problems. For example, controlling the diabetes is extremely important for these patients. As I mentioned, patients who have fatty liver disease, a small segment of these can progress into scarring of the liver, leading to what we call as cirrhosis. It becomes like a rock hard like this. When they develop those things, they have the complications which include jaundice, is the yellowness of the eyeball, and also develop fluid accumulation within the stomach. And these are the patients who needs urgent gastroenterology advice.